just under the welcome message. So
fantastic.
I'll pass over to you.
Great. Anna, quick question in terms of time. So I've got a short version, which is just a really easy intro. I could do a long one, but that would probably take more like 45 minutes. I suppose that's too long.
Well, it's totally up to yourself, Sven. I think people would probably benefit from the information. So we've got from 1 till 2 p.m.
Okay, so we've got an hour.
Yeah, you've got the hour, and if it's slightly longer, then if anyone has questions, please just ask them throughout, and we'll pick them up.
Yeah.
In case there's not as much time at the end for questions, if people have them. So we'll work it that way. Perfect.
Good stuff. Thank you very much, Anna. Thank you.
Thank you.
Okay. Right. Welcome, everyone. It's a great pleasure to be able to talk to you today about our program, the MSc Investigative Ophthalmology and Vision Research here at Glasgow, Caledonian. My name is Sven. I am the program leader of the MSc, and I'll give you a little bit of an overview of what the program entails, what we do, and what it's all about. As you've already heard, we can answer questions at any time. So if you have anything, you may want to drop this into the chat and let us know. So we'll try to address these as we go. The MSc is based at Glasgow, Caledonian. So it's a university that is what we call a modern university. It's one of the top ranking modern universities in the UK. It's the only university in Scotland that offers this kind of degree. A degree, postgraduate degree, taught degree for optometrists and primary eye care practitioners. Now, GCU is a campus-based university. We are located at in the city centre of Glasgow, the largest city in Scotland. We have about 22,000 students from more than 100 countries, so a really international university. And of course, the program itself is international. Okay, so you would be studying or will be studying with people, colleagues from other countries, a range of other countries. The campus, the university are very welcoming. I think you would find it quite easy to feel at home and settle into student life here in Glasgow and at GCU. So overall, I think it's a great place to study, a great place to be for your postgraduate degree. Of course, we realize that most, if not all of you, would be coming from a kind of practical background. You will be leaving your clinical roles behind, be that in primary eye care settings somewhere in the community, maybe in optometric practices, maybe at hospital eye clinics. So you would be making a big step. So we realize and recognize that. And I think coming to Glasgow is I think, a great option. Looking a bit wider, so when you think, okay, so what else is there? Maybe you want to learn something about the UK and specifically Scotland. I think you would have a great opportunity to do that as part of your studies. So there's lots to see in Scotland. So from sporting events, nature, culture, you name it. So there's a lot of things that you can do. Try to see while you're here in Scotland. The program itself is hosted by the Department of Vision Sciences. And maybe I should say that the program has been in existence for now 13 years. So I've been leading the program since the beginning. And the program is embedded in a portfolio of vision-related programs in our department. So we run an optometry undergraduate program, an orthoptics program, a dispensing program, the MSc, and we have a number of PhD students as well. In case you're wondering about the undergraduate program, on the website you will find that the optometry undergraduate name has changed. It's now called the M.Optom, Master of Optometry, for students based in the UK. So that has changed. This basically now makes it 2 master level programs. However, that is a 5-year program, so not applicable to international applicants. Okay, so the MSc Investigative Ophthalmology and Vision Research is a one-year program, a postgraduate program, and that's what we're talking about here today. We already said it's an international program. The class size is somewhere between 20 and 25 students in most years. Occasionally we have a few more students. So I think it was last year where we had about 30 students. But we had other years where the class was a little bit smaller, between 18 and 20. And I think this year's the cohort is 25 students. So a nice group size, usually large enough to make it interesting, large enough to be able to benefit from the knowledge of your colleagues, your classmates, your peers. At the same time, it's small enough to make sure that you are making friends, that you get to know people. And often MSc graduates stay in contact long after they've graduated and left the university. So I think you will be able to build friendships and make contact with other people quite easily. You will certainly get to know your classmates during the course of your studies. So we take quite an inclusive approach to working with our students. Of course, you're signing up as a student, but as I said, we realize you're typically practitioners. You come with work experience. You're what we call a mature student. So mature students, we love to hear about their experience. And of course, eye care is being practiced quite differently in many different countries. So whether you're from India, from Nigeria, Ghana, elsewhere, your experience, I think, is very valuable, and you bring that to the program, and that actually benefits your faculty. So your teachers, your tutors will learn from you, will learn about how eye care is being practiced in your respective countries. So that, I think, is quite an exciting aspect for us as your tutors and lecturers. So some of this information you may have seen on the website. So I'm going to talk you through briefly what the program is for, what we do and what we don't do. The general idea when we set up the program was to have an international program for primary eye care practitioners. So this includes primarily optometrists, but we've also had orthoptists and other related professions. We've had ophthalmologists at kind of junior level joining the program and benefiting from it. And we typically have students from people who have trained outside of the UK. Okay, so there are a few UK-based students who also take the program, but the majority of your classmates will be from outside of the UK, such as yourself. The focus really is to try to develop your skills in two main areas. One is the kind of clinical component, and one is the research component. And in a clinical setting, certainly in eye care, in optometry, in optometric practice, the research really informs the clinical decision-making. And that's what we're trying to bring together. So we're trying to teach and develop your knowledge in both areas. But ultimately what we want is we want to put you in a position where your decision-making is going to be improved, enhanced. And that's where the research really plays an important role. The research really informs our clinical decision-making, and we're using that as a basis for our teaching. Now, there are a number of things, and this is a question, or these are questions that come up every year, a number of things that we don't do. And I think you need to know this at the earliest possible time point. There are no wet labs. So if there's someone here today who is maybe looking to develop as an ophthalmologist, maybe get some surgical training, things like that, this is probably not the program that you would be looking for. Okay, so this is a program for primary eye care practitioners, for primarily optometrists. If your aim is to do wet labs and surgery and things like that, maybe take one of the UK fellowship examinations, then there are probably other programs out there that would be better suited to your needs. We're also not offering professional accreditation in the UK. So some of you may be aware of the General Optical Council. This is the regulatory body of optometry in the UK. And anyone who intends to practice as an optometrist in the UK needs to be registered with the General Optical Council. So the program itself is not designed to give you that accreditation. Okay. However, it will probably help you in the process because it will cover a range of aspects that the GOC is typically looking for, but it will not give you automatic accreditation or registration. So please be aware of that. I know we talk about these aspects in many of the interviews that we're doing. For those of you who are not familiar with the process, every eligible applicant to the MSc will be invited to join us for a brief chat, an interview, typically a small group, like 3 or 4 people, and you would be talking and chatting with myself. So we'd have a chance to talk about these aspects, and the GOC registration typically comes up in those conversations. Okay. So what our graduates are telling us is really that our idea of enhancing clinical and research skills is really working. So the feedback, which we collect every single year from our graduates, the feedback tells us that yes, the program does make a difference to career development, and it allows practitioners, graduates of the program, to either take up PhD positions or maybe more senior roles in hospital settings and things like that. Some of our graduates have gone on to do teaching, so they entered university, became faculty members, and started lecturing. So that there are a range of career opportunities, and as I say, the feedback from graduates indicates this is working as intended. So in terms of the structure, it's very straightforward as far as MSc programs go. So this is a taught degree. So it basically means you will have a number of lecturers, tutors, and a number of different modules. The program runs over 1 year on a full-time basis. This means you're expected to be in Glasgow for that period of time. Okay, we typically start in September and then run till the following August. So basically 12 months period. The part-time option, which is listed here on your slide, is available only to UK-based students. Okay, so please bear in mind, if you're joining us today from outside of the UK, if you're not a UK passport holder or not a UK resident, you would be eligible for the full-time option, but not the part-time option. The main reason for that are visa-related. So this is not in our hands, but if you're joining us from outside the UK, are not a UK resident, it's the full-time option that you'd be looking for. We have a range of modules. So the program is split in different modules. The biggest of those is the research project. Remember, we said that one of the main pillars of the program is the research element, and the research project is a main part of that. When you're selecting your modules, there are a number of modules that we call compulsory, so you can't really select them because they will be selected for you. So you have 4 core modules, as we call them. And then you can select out of a number of optional modules. Overall, your choice needs to be made in a way that you can accumulate a total of 180 credit points. That's what's required for an MSc. So relatively straightforward. As part of our introduction, when you come to Glasgow, when you're joining the program, we will be sort of looking at those module choices. I'll give you some examples, and you can make your choice based on your preferences. There are a range of modules available. Some of these I would call generic, okay, so can be taken by anyone. And some of these are very specific to diabetes, so the systemic condition of diabetes. And the diabetes modules, I think, are really interesting, really good, but they're probably most suited for people who have at least some interest in the condition. And of course, diabetes being a big contributor to ocular disease, I think there's a good reason for having these two modules on diabetes. And every year, a number of our students take the diabetes modules, so they can specialize a bit in diabetes if that's in their interest. Okay, there's some therapeutics modules which lead to a therapeutic stream, but again, that is more the part-time version of the program, not the full-time version. So this is heavily tailored towards UK-based students. And the main reason is that therapeutics is very heavily associated with regulation, so with laws. And those laws are obviously different in every single country. So practitioners from, say, Nigeria have a completely different legal system in eye care compared to practitioners working in India. And one of the big differences here, using these two examples, is that practitioners in Nigeria would be able to diagnose ocular disease, prescribe ocular therapeutics in their everyday practice, whereas practitioners in India very often cannot do that. So for covering these differences in the legal system is impossible to do within a one-year program. And this is why those modules in that kind of stream is restricted to UK students. I thought it might be helpful for you to see an example of what a module combination can look like. Obviously, there are different examples. This is just a single one to give you some idea. So what you see here is basically the name of those different modules, the credit points in that third column. Most of our modules carry 20 credits. The research project, being the biggest one, carries 60 credits, and a total of 180. And then we have a trimester structure, which means the academic year, so the period between September and August, is divided into 3 different parts. Each is 1 trimester. So trimester A, for example, runs typically from sort of mid-September until early December, followed by an exam period. And then trimester B starts in the next calendar year. So some modules are running just over 1 trimester. Others, like this one here, Advanced Binocular Vision, runs over 2 trimesters. So A and B, or Advanced Clinical Investigation, B and C, or the research project, which is running across 3 trimesters, so over the entire year. So I think that gives you a little bit of an idea of those different different modules, their credit counts, etc. A question we always get every single year is, could I take more than 180 credits? And the question is, yes, you can, in theory. But what we recommend to all our students is that you need to be very mindful of your workload. So anyone who selects more than 180 credit points will have a slightly higher workload. And if you select too many credit points, your workload may simply be too high for you to manage within those 12 months. You need to remember that each and every module is associated with coursework assignments, with potentially exams. These could be clinical or maybe written exams. And you would need to make sure that you complete all these assignments and exams successfully. And that's associated with quite a bit of work. And it's a big time commitment. So you need to be really careful. If you go, say, and select modules worth 190 credits, I would say that's still very doable. But if it goes beyond 190, that's where it gets really tricky. Yeah, so you might not have enough time to actually complete this successfully. But yeah, 180, and that's one of the main messages here. 180 credit points, that's your minimum. You need that in order to be eligible for an MSc. If it's less than that, you would not have the option of graduating with the MSc. So 180 is what you definitely need. In terms of teaching, so we use a range of techniques here. So we call it a blended approach, so blended learning and teaching. So it basically means we use lectures lectures can be online. Some of these may be pre-recorded. Some of these may be live online. And of course, many lectures are on campus. There are differences between different modules, and people take a different approach. So by people, I mean your tutors, your lecturers. Now, we have a lot of teaching which is practical, and that obviously is taking place on campus. So you will be here basically every day doing something on campus, hands-on. Yeah, that's very, very common. And that is to help you consolidate any knowledge that you've gained in your lectures and tutorials, and try to sort of place that into a more practical context. You will have meetings, I think, fairly regularly with tutors and supervisors. These can be either in person, so in the office, or maybe online. So there's a mix that we use here. But overall, the university's policy is to have as much teaching as possible on campus. So if you're wondering, is most of my teaching going to be on campus? Yes, it will be. So if you wanted to ask any questions, we're very happy to take questions now. And I think I can see in the chat there are quite a few of you joining us here today, which is great to see. So we take questions now, but if there's anything that you wanted to ask about in confidence, you could drop us an email. So my own contact is here listed at the top, and you could also make contact with my colleague Professor Neil, and you can see his email address here. So feel free to drop us a message. But before I do that, if there's anything else you wanted to ask now, please do so, and I'd be happy to try and answer. Thank you. So I'm just looking at the chat here. So I can see Kanis. Yeah, very good. Hello. And Deepika. Yes, nice to meet you. Nimeka. Very good. From Nigeria. Brilliant. And another colleague from Nigeria, Etumirani. Yes, welcome. And a colleague from India, Amrita. Very good. And Deepika, you've got a question here. So can I apply for the GOC? So let's take that as a first question, maybe. So the question is, can I apply for the to the General Optical Council for registration while doing this course? Yes, you can. Okay, so that's the short answer. Applying to the General Optical Council, as we said a little bit earlier during the session, is a prerequisite if you ever wanted to practice as an optometrist in the UK. It's a process that is available to any optometrist who qualified anywhere in the world. What the GOC will do, they will look at your application, they will look at your transcript, the numbers of hours that you've done, and they will review your application and your previous education and experience very, very carefully. And they do this on a one-to-one basis, and comparing your expertise and your training to the standard that they have set for UK optometrists. So they're basically comparing what you bring to their own standards. And typically the next step then is to invite you for an interview. So note, this is totally different from the MSc interview that we do. Yeah, so the GOC asks you to invite an interview, which typically takes about an hour or so. And one of the assessors will then sort of ask more about your experience, typically your clinical experience. The application to the GOC can take some time. There's usually a fee associated with that. The easiest way to get some information on that would be to say, okay, have a look at the GOC's website. It's www.optical.org. Okay, so and there's an option under registration where they have a site specifically for international applicants. So that would be your starting point. So optical.org, and then look for registration, and then go to international applicants or international optometrists. So yes, you can apply. One of my colleagues here at GCU is an advisor to the GOC, and we typically have a GOC information session during the, or as part of the program. So I think the most recent one was just 2 weeks ago. So people who are on the program, students who are interested in applying, we would give them as much information as we can from the perspective of a GOC, of a GOC advisor. Okay, I hope this helps, Deepika. So I hope this makes sense. Okay, so here's one question that may be interesting to some of you. When is the deadline for sending an application for the program? Right. It's a bit trickier to answer, a bit more difficult. First, we accept applications year-round, so you can apply at any time whenever you feel ready to apply to the program. However, you need to bear in mind that we only have a single start date per year. That start date is fixed, and you need to be in Glasgow by that point in time. If you're not, you would have to either defer or reapply to the next for the next academic year, which is 12 months later. Okay, so that intake is, or that start date is September 2025. That's the next possible opportunity for you to start. And of course, you would need to go through the application process. We need to do the interview. And you will need to look to see if you need to submit any additional information. For example, a language test is sometimes required. You need to get transcripts from your previous university. You need references from maybe your employer or maybe other professional colleagues. And if you then are at the point where the university makes you an offer, you would need to accept that offer. You will then wait for the confirmation of your academic studies, CARS, and then you start to apply for your visa, which also can take a fair bit of time. So what I'm trying to say here is that there is a fair amount of time needed to not just apply, but to get your application and all the associated steps processed, including visa. And don't underestimate the visa situation, okay? So you need to have a fair amount of time to do that. So it's a difficult one, and maybe Hannah can come in to advise on the latest possible time date. But I would say now is a really good time. If you took maybe another couple of weeks to think about it before you apply, that should be fine. But I would say if you're planning to join us in September, February is probably an ideal time to apply. Hannah, I'm not sure if you can still hear us okay. Okay, so maybe we come back to that. Okay, so I hope this helps, Itumirani, for in terms of your question on the deadline. Okay, so yeah, Kanis, I see you here. Hello, watching from Nigeria. That's great. Okay, and Amrita, yeah, I think we've spoken during the interview probably, so we may have had a chat before. So good to see you again. Okay, so a good question here is, how is the research aspect structured? Okay, so is there a dissertation or thesis component? Yes, there is an MSc project to be completed and a dissertation to be written. Yeah, so you will have to write a substantial piece on your research findings. So the vast majority, I think, of our research components of the research module is a project. So for most students, that means they will develop a research plan, develop a research question, and then come up with a protocol how to answer and address that particular research question. Many of the students will collect some data. Often that's clinical data. So many of our projects are clinic related. So it means students will be collecting clinical data, then carry out some statistical analysis, draw conclusions from the findings, and then write this all up in your as your MSc thesis. Some of the MSc research aspects are literature-based. However, these are just few. So some students opt to do something like a scoping review or maybe a systematic review or something like that. So a substantial or very substantial literature-based piece. However, these are not as common, and I think projects are more common, more common, more frequently done. The project itself starts quite slowly. So in trimester A, so when you first join in September, nothing much is happening. But then in the second half of the first trimester, you will be given a list of potential topics, and you will then be able to talk to potential supervisors, learn a bit more about the project idea, and then submit your choices to the module leader who will make the final allocation. We've also had students in the past who brought their own idea for a research project, and we're always very happy to consider your own ideas. So if somebody came and said, oh, I want to research this and that, we'd always be happy to consider that. However, it has to be practical enough or feasible so that you can actually do this and achieve this within the year of study. So sometimes students bring very ambitious projects, and then sometimes we need to tailor this a little bit to really make it fit for an MSc. Yeah, so it can't be too complex. However, if you have a topic you care deeply about, you just bring that along and we'll talk about it and try to link you up with a suitable and experienced supervisor. Yeah. There's a related question, so I'm jumping the queue here a little bit, but I'm using that. Amrita, you're asking, can students collaborate with faculty members on their ongoing research? In principle, yes, that's possible, but I'd like to come back to the workload question. So we said earlier, we need to be mindful of that. The program, to be very honest with you all, it can be quite intense. Okay, so you need to be prepared that you need to work on academic stuff almost every day. Okay, so it's an intense one-year program. If you then wanted to do some part-time work outside of the university, you'd be allowed to do that. There's a certain limit, but in terms of how many hours you can do, but you'd be allowed to do that. If you then wanted to include some social activity, maybe some sports, maybe some relaxation time, there's not that much time to then also collaborate on research. Okay, so that's the first thing I would say. So be very, very cautious in terms of how you divide your time. But in principle, yes, it is possible. If you had time available, you could talk to individual members of staff who are research active, talk to them, see if they could use any support in their labs with particular projects. And if they're happy to have you, then that would definitely be an option. However, I don't want to make or give a guarantee on that, because it really very much depends on which projects are available and what stage the projects are. Have they just started? Are they roughly in the middle, or are they just about to finish? So it really depends. So the research is very dynamic. And I think the easiest would be, if you were interested, you would come, you would talk to people, staff members, and see what's doable. But yeah, short answer, in principle, yes, it's possible. Mega, you're asking a question about guidance for the project, so it's also related, which is great. So yeah, you will be given guidance, and there's a substantial support network available. So the first and probably most important one for your research project is going to be your project supervisor. So every student will have a project supervisor, sometimes a team of 2 or 3 supervisors, and the supervisor will guide you as to how to approach the different steps of your projects, from developing a research question to developing a protocol, carrying out the research, and writing it up. So you will be given a lot of support in that way. There's also more generic support. So what I think is a really useful tool is a session, tutorial session that we run this trimester, so in trimester B, the second trimester. They are MSc research tutorials where students give a very short overview of their own projects. And this is in front of all your classmates and either myself and a colleague or two other colleagues, so two experienced supervisors. And we would then try to look at the strengths and weaknesses of your project plan. Okay, so we'd be looking at the work that you're aiming to undertake, talk about it, discuss it, look at things that sort of could potentially be very challenging or maybe problematic, and sort of look for solutions as to how these can be resolved. So these MSc research tutorials are independent of your supervisor. Okay, so you've got your supervisory team, you've got the MSc research tutorials. And then a third element in terms of support for your projects is a team. It's called the Learning Development Center, or LDC. And the LDCs consist of colleagues who are very experienced student support tutors. And they can help with all sorts of questions relating to technical aspects. For example, how to write, how to manage my time, how to use Excel, how to use PowerPoint, how to structure an MSc thesis, things like that, and many other. So there is that kind of added element of student support where you can develop your, what I would call, generic skills, your general academic skills, and you can definitely develop that. And I think the combination of supervisors, research tutorials, and also LDC, that seems to be working really well. So I hope that is reassuring. Okay, coming back to a question on modules again. So Himari, you're asking, is it possible to select a mix of courses from either diabetes or generic streams? Yes, you can do that. Okay, so in that case, you would be on the generic stream. And if you thought, for example, oh yeah, one of the diabetes modules looks really interesting, I'd like to do that and select that. Yeah, you can do that. Yeah. So many students select it's a module called Diabetes Care. It runs in trimester A. It carries 20 credit points. And it's a really, I think, well-designed module, which students seem very happy with and seem quite pleased with. So short answer, yes, you can select one of the diabetes modules quite easily as part of a generic stream. Yeah. Okay. Great. Deepika, thanks. I'm glad you found the chat we had about the GOC useful. Yeah, so we're really happy to hear that. Thank you for your feedback. Okay, there's another question here about courses and modules. And the question is whether we can take some courses as CPD, as adaptation courses for the GOC application, and if the GOC approves of it, instead of doing the whole one-year program. That's a good question. I think the answer is possibly. I can't really give you a definitive answer. So my role is that of the MSc program lead, and I work with my colleagues who deal with adaptation modules, but it's generally a different scenario. If you wanted to know more about adaptation, my strong recommendation, and this is only for anyone who is interested in just doing isolated modules, but not an MSc. If you're interested purely in adaptation, you may want to drop a message to Professor Neil. So the lower email on the last slide, okay? So email Professor Strang, ask your question about adaptation and which modules you need. If you have any information from the GOC, tell them exactly what you're looking for, whether it's pediatric or low vision or contact lenses, whatever. So we have students who do exactly that, but it's a different application route. It's not the MSc application route. Yeah. So contact Professor Strang. He's the best person to advise on adaptation modules. Okay, good. Great. Okay, so thank you for your feedback. So Mega, thank you for that. Amrita also, thanks for your feedback here. That's really good to hear you. That the answers have helped. I have one question here from a colleague from Pakistan, from Kainat. Hello, Kainat. Good to see you here. You've completed your graduation in optometry with 1 year internship practice. So yes, Kainat, you would be eligible to apply with your experience. So we typically ask for the following. We ask for completion of your degree, and ideally for a minimum of 1 year work experience outside of your internship. So if you've completed your degree and your internship, and you've had 1 year of clinical experience on top of that, that would be what our recommendation would be. Now, we will ask you again if you decide to apply, and if you decide to come along and come to the interview, we will talk about this again in a bit more detail during the interview. The main reason is that most of our students bring that kind of level of expertise. And if you came straight from your degree, so you do your bachelor's, for example, and then a couple months later you come to Glasgow to start your MSc, you probably will have formally the required qualification, but you will probably also be disadvantaged compared to what your colleagues can do, your classmates can do. Because there is usually that kind of understanding that a certain work experience of at least 1 year is really beneficial to make you competent and confident enough to really study for a postgrad degree. Remember, it's a big step coming to a different educational system. As I said earlier, you may have heard this before, it is quite an intense program because it's 1 year. And that's quite typical for, I would say, all international 1 year programs. These programs tend to be intense, and this one is no exception. So with that additional work experience, you'd normally be a bit more, I think, confident in your techniques and in your diagnostic techniques, Vogue lens, things like that, basic slit lamp use. However, we don't expect you to be absolute experts. Remember, you're here to develop clinical and research skills. You would not be here if you were the total expert. So we're not looking for experts, so don't get me wrong on that. But we're looking for a basic level of expertise. I think that's probably the best way to describe it. Okay. Right, I can't see any further questions. I hope I've not missed anyone. Okay. Okay, Hannah, I think we are basically done.
I think so. Thank you so much, Sven. Sorry, I just wanted to make sure I came off mute at the right time there. Oh, I knew another question would come in. There's another one.
Oh, yes, Amrita. Yeah. Okay, great. Yeah. Okay, and Deepika, you've basically got the same question there.
Yeah,
okay, so,
same ones.
Yeah, okay, I'll deal with that straight away. I think it's easiest to do. Right, so the question here is it possible to go on and study for a PhD, so for a doctorate afterwards? Short answer, yes. Now, I said this right at the start, we've been running the program for 13 years, and we've had a good number of graduates, MSc IOVR graduates, who went on, applied, and got PhD positions. And many of them have actually graduated already years ago. So this MSc is a really good stepping stone if you're interested in undertaking a PhD afterwards. It certainly will give you, and that's partly through the research project, it will certainly give you a good grounding in how to develop your critical thinking, okay? And that will be further developed as part of your PhD. It will help you in dealing with academic writing to UK standards. It will help you to sort of, look at particular research methods, advantages, disadvantages, statistical analysis in a slightly more advanced way. So all of these aspects really contribute to making a good PhD student. And so our graduates are telling us, yes, this has worked and it has actually helped me on my academic journey to becoming or gaining a PhD, be that at GCU or other universities. So PhD positions are a little bit like job positions. You basically, if one is being advertised, especially when it comes with a scholarship, you basically apply as if you're applying for a job. If you're shortlisted, then you get invited for an interview, and then the panel makes a decision. So it's a bit like that. So these places are highly competitive. You would need to be very patient. I would advise, okay, if you're thinking about doing a PhD, think about a kind of a planning and application phase of at least 1 year. So that's often how long it takes before people have secured a place. Yeah. Now, places at GCU do come up. We still have a good number of PhD students. Some of them are external. Some of them are MSc graduates. So it's a good mix and has been for a number of years. So we've frequently had MSc graduates just joining us for PhDs. So yeah, it's possible. And I think you'd be well prepared to undertake a PhD upon completion of this program.
I think, is that us now? Any other questions?
Yes. No, I think, well, the chat looks okay, but
it does. Wait a
moment.
We'll wait a wee minute, just in case. That was great, Sven. Thank you so much. And a really good webinar in terms of participation as well. Lots of good questions, so that's really good. Just to say to everyone, before we finish up, that this webinar has been recorded as well. So I'll make sure that the scholarship opportunities. So I don't know if you have any additional knowledge on this, Sven, but in terms of scholarship opportunities kind of across GCU postgraduate programs, most of them are listed on the website. So I can put the link in. I've just got a message here just to say thanks to everyone, but I'll then follow that up with the scholarships link. And you can access that and you can just have a read through all of them, because there's quite a lot of kind of scholarship opportunities and funding support that is worthwhile having a read through, because you never know where you could get a bit of support in that area. So I will do that. However, I just wanted to say a huge thank you to Sven for joining us today.
No problem.
For this hour, and thank you to everyone for joining us on the webinar and for all your really insightful questions and lots of great answers as well. So as I said, the recording will be available. I'll send it out to everyone who has attended the webinar and also to anyone who signed up and couldn't join us today. But again, thank you so much, and feel free to get in touch with Sven or Neil at the email addresses just listed on the slide. But thanks very much to everyone again, and enjoy the rest of your day.
Thank you. Bye-bye, everyone.
Thank you.